This figure illustrates the shoulder joint, and most of these structures you don't have to know, but there are a few that you do, and so I'm going to run through those structures that you're responsible for knowing from the shoulder joint. First, let's identify the bones. This, of course, is the humerus, head of the humerus articulating with the glenoid fossa of the scapula. Here above this joint is the clavicle. Some bone features that you're responsible for knowing, which you should already know from the appendicular skeleton, are the acromion or acromion process of the scapula, as well as the coracoid process. Coracoid, if you remember, means crow's beak, and it looks sort of like a crow's beak if you really look at it. You're responsible for knowing the coracoacromial ligament, which is this ligament that attaches the acromion to the coracoid process, and just notice that it has the two bones in its name, coracoid process as well as the acromion. So if you know the names of these bone features, then it's very easy to remember the name of the ligament that attaches to both of them. Ligaments, by the way, attach bone to bone. Don't confuse ligaments with tendons. Tendons attach muscle to bone. Ligaments attach bone to bone. Another structure you should be familiar with is called the subdelta bursa. That is this bursa here. Now, bursa is basically a fluid-filled sac. Its function is to cushion one component of a joint against another, or from another, I guess I should say. It's a deltoid bursa, subdeltoid bursa rather. Sub meaning below, bursa referring to deltoids. This is below the deltoid muscle, which is above it, of course. Lastly are the glenohumeral ligaments, and you've got a couple. You've got one here, and then you have another one here. So again, let's break the word down. Glenohumeral. Gleno refers to this cavity here, or it can refer to this depression here, which is the glenoid fossa. And humero refers to the humerus, of course. So again, the name refers to the two locations that it attaches. Glenohumeral ligaments. So I want to stress that knowing the anatomy of a joint really relies on you knowing the bones and bone features. If you know the bones and bone features from the appendicular skeleton, then it's really quite easy to learn the structures of these joints. We are now looking at the elbow joint, where the humerus articulates with the bones of the forearm, the ulna, and the radius as identified here. Now, of course, you won't have these identified for you. You'll have to be able to distinguish between the two. What I can promise you is on any image of this joint, it'll be obvious if you're looking at the anterior view or the posterior view. Since this is the anterior view, we know that the ulna is the medial bone and the radius is the lateral bone. Knowing that this is medial, it's easy for us to identify the medial epicondyle, also known as your funny bone, although that's not an acceptable term for it on a quiz or practical. And this is the lateral epicondyle. You also have to be able to identify three ligaments, and again, they are named for nearby bones. You have the ulnar collateral ligament, which connects the medial epicondyle of the humerus to the ulna, and all you have to remember is, hey, it makes contact with the ulna, therefore it's the ulnar collateral ligament. You also have to know the radial collateral ligament, which is this ligament here that connects the lateral epicondyle with the radius. And then lastly, there is this annular ligament that you must identify that wraps around the head of the radius. This is just a medial view of the same joint, the elbow joint. I'll point out that this, of course, is the ulna. You can see what is your elbow here. This is the radius. As this is the ulna, here's another view of the ulnar ligaments here, or ulnar collateral ligaments, rather. Make sure you include all three words. And we can't see the radial collateral ligament, but you can see the annular ligament here wrapping around the head of the radius. We're now looking at an anterior view of the hip joint. Let's name the bones first because the ligaments are going to be named after the bones. Here we have the ilium, the pubis or pubic bone, and the ischium. Those bones are articulating with the femur. Here we have the greater trochanter of the femur and the lesser trochanter of the femur. First, let's identify the ligaments that attach the ilium to the femur. And this is the iliofemoral ligament here. The pubofemoral ligament is here. It attaches the pubic bone to the femur. This is now a posterior view of that hip joint. And looking at the posterior side, this is the ischium, much better view of it now. And this is the ischiofemoral ligament here. This is the iliofemoral ligament that we saw in the anterior view. This is a superficial view of the knee joint. There are three structures that I'd like to identify on this image, and then the remaining structures I'm going to identify on a dissected image. What you're seeing here are the quadriceps muscles, or three of the four anyway. They include the rectus femoris here, the vastus medialis, the vastus lateralis, and then you have one under the rectus femoris called the vastus intermedius. Those four muscles make up your quadriceps group. Those muscles all attach to the patella via the tendon of quadriceps femoris muscle here. The patella then attaches via the patellar ligament to the tibial tuberosity. Notice this is a ligament because a ligament attaches bone to bone, and this is a tendon which attaches muscle to bone. I wanted to point these structures out on this model because they're going to, or this image rather, because they're going to be dissected or cut away on subsequent images. Before we start identifying different structures of the knee joint, let's make sure we can identify the bones first because several structures are going to be named after those bones. So this, of course, is the femur of the thigh, and then here we have the tibia, that's the large bone, and the fibula, the smaller bone. So it's important to be able to identify those bones. So the patella, which was here, has been removed. What you see here is the patellar ligament that attaches to the patella on the anterior side and to the tibial tuberosity on the posterior side. Okay, let's get to the structures you have to know. This is the fibular collateral ligament. It attaches the femur to the fibula, named after the fibula. On the medial side, we have the tibial collateral ligament because it attaches to the tibia. these two structures that cushion the medial and lateral condyles of the femur are the meniscuses. We have on the lateral side the lateral meniscus, of course, and on the tibial side the medial meniscus. This structure here, which attaches to the tibia anteriorly, although it attaches to the femur posteriorly, is called the anterior cruciate ligament, also known as the ACL. I joke about how everyone knew what an ACL was before I did. I would hear all the time people would say, I tore my ACL, I tore my ACL. I'd have no idea what they were talking about until I started teaching about this joint. And now I know it as the anterior cruciate ligament, and most people don't know its actual name. They just know the letters that are used to abbreviate it. We're now looking at the posterior view of the knee. Here's the femur, here's the tibia, and the smaller fibula. And remember that the fibula is the lateral bone, the tibia is the medial bone. Now that we've identified the bones, we can now identify the structures. This is the tibial collateral ligament attaching the femur to the tibia, and on the lateral side, the fibular collateral ligament attaching the femur to the fibula. The tibia is the medial bone, so this is the medial meniscus, and this is the lateral meniscus. This structure here is the posterior cruciate ligament. You always hear about the ACL. Rarely do you hear about the posterior cruciate ligament, or PCL. I don't have a leader line pointing to it, but I'll point out that this is the anterior cruciate ligament. It has a posterior attachment to the femur and an anterior attachment that you can't see here because it's on the anterior side, but an anterior attachment to the tibia.